Morning, everyone. Welcome. I'm Dr. Jim Sluss, the interim president here at OU-Tulsa, and I have the honor of being the MC for today's event and introducing you to the outstanding leaders and donors who have joined us here today. At this time, I'd like to recognize a few special guests. OU Regent Anita Holloway. Welcome. Sciences Center Interim Provost Gary Raskop. Gary, are you here? Former College of Dentistry Dean Stephen Young. Stephen, are you here? Welcome. Joining us virtually is also former College of Dentistry Dean Raymond Colmia. We have several leaders from all three university campuses joining us today. Also in attendance are several deans and students from the College of Dentistry and members of the Delta Dental of Oklahoma senior leadership team. Welcome. In July 2021, it was announced that the OU College of Dentistry would be expanding its pre-doctoral program to the OU-Tulsa campus and building a brand new state-of-the-art dental clinic. The addition of the College of Dentistry clinic on our campus is a natural extension of the healthcare services offered at the Schusterman Center Clinic and also provides outstanding interprofessional training opportunities for our students. It's now my pleasure to introduce the president of the University of Oklahoma, Joseph Harroz, Jr. He served the university for over 25 years in various leadership roles and was named the 15th president of the university in May 2020. Please join me in welcoming OU President Joseph Harroz, Jr.
Thank you all. Thank you, President Sluss, and thanks to everyone for being here. While we're all masked, it's great to see so many folks that are family and to be together in person. So thank you for being here. Want to make sure we thank everyone. I think we're getting close to thanking everyone. So if you haven't been thanked, thank yourself. But I do want to make sure that we express gratitude to our new dean, Dean Paul Mullasseril, who is here. Dr. Rieger Wood, who is also with us, and of course President Sluss. So thank you all very much. Now, the problem with being a family is you know too much about each other. And my brother-in-law was dean here, and I spoke to him just before I came in here, and he wanted to make sure I introduced him a second time. Just to be clear for those reporters that are out there, before I became president, he was already dean, and now he's gone. He's now president of the American Dental Association. He's watching us virtually, so to him and to all of those that are a part of this, thank you for the incredible work you've done to make this possible. Truly grateful. That's, I think, clap-worthy. Yeah. All right. Having now discharged the familial obligations, I do want to say, and to me, there are other speakers I've got a 5-minute spot, but they gave me 7 pages of talking points. That's right. Which way is this going to go? I'll keep it brief, but I do, there's so much to talk about. And I know we're going to have speakers after me that walk through the specifics of this new clinic here. But we talk a lot. The regents and I and all of us talk about our strategic plan. And all of it pulls up to one thing, which is we change lives. And seeing our students here in the white coats, or those that are imposters, it appears you're real dental students. But seeing you all here, this is who we are and what we do. And moving into this new comprehensive clinical space, having this opportunity expands our ability to provide oral health care to so many, both through the training that takes place and the education of those that are being educated to be our dentists of tomorrow, but also to provide care for those who would otherwise never have the opportunity. And the numbers are somewhat staggering. Right? They wouldn't otherwise be able to afford or have access to oral health care. And the numbers are fascinating. Right now, our clinic in Oklahoma City serves 2,400 patients. And interestingly, 600 of those already come from Northeast Oklahoma to receive that care because they wouldn't receive that care anywhere else. Right? How many more cannot make that trip that need that care? And so when we look at what is the need, how do you change lives? This to me is a perfect example of what we do as a university, and it's never more clear and more apparent to the population as a whole as when they receive care for their health that wouldn't otherwise have taken place. So it's an important and fundamentally important day. And what the College of Dentistry does is so important. 73% of all dentists in Oklahoma were educated at the OU College of Dentistry, and we hope to keep expanding on that with moves such as this. We know the demand is so much greater than the supply and for the providers that are out there. So grateful to you all for being here. Now, we often talk about how do you do this, right? How do you have the opportunity to expand health care for the citizens of a state and for a region? And the answer is these days we know it's not enough to have a single institution do it. And when we look at partnerships, what we're celebrating today is not just an announcement with Delta Dental of Oklahoma and its foundation, but it is now a 20-year plus relationship. And understanding that relationship is so important because it has an impact not just in today's announcement, but for the past 20 years. Right? And it's stunning to see what one organization can do to help out people beyond its own interests. And I'm going to cover just a few of those because a lot of these pages are dedicated to that. But this giving history, really, the big gift began with the largest single gift to the College of Dentistry ever in 2013. And that was a $3.2 million gift in Oklahoma City, and it allowed for a complete transformation of the college and also the provision of a comprehensive clinical space to allow for that teaching and the provision of the oral health care. And to me, that was the first really big move to make this reality of this mission possible. If we look at the scholarships that have been provided, that's sort of the next big category, right? From capital to scholarships. Over the past 20 years, as of 2021, over $1 million in scholarships have been provided to students that are in need, students that are exceptional, and students that have shown a commitment to being a part of their community. And we talk about the involvement and engagement in the community. That is what OU-Tulsa embodies with the School of Community Medicine and all of the programs, social work, early childhood education. When you look at the mission and purpose of OU-Tulsa, what we see is a perfect partner in Delta Dental with what they've shown over the years. I know it's getting a little long, so I'm going to bring this down into a couple more categories. Community outreach. Delta Dental has been behind the efforts of the College of Dentistry for decades, for the last 2 decades. Just a couple of examples. One of those is the annual Kids Day. Kids Day is possible where all kids between the ages of 4 and 12 on that day receive free oral health care. And there are screenings done for the kids that are 1 to 3 years old. They also pre-screen these kids so that they're not waiting on a first-come, first-served basis on the day of the event, making it more efficient and less taxing for them. There's also a community-based dental education externship program that Delta Dental is a part of that allows our fourth-year students to get enhanced clinical experience and also to provide more care to underserved populations in Oklahoma, and also inspires those dentists in training, those fourth-year students, to take their practices ultimately to, on a full-time basis, permanent basis, those underserved communities that we know so desperately need dentists. And then there's the funding for the clinic patients in need. When a patient comes all the way, in many cases, from Northeast Oklahoma, historically to Oklahoma City, to the clinic there are those that can't even afford those lower rates, and Delta Dental has stepped in there to help make that care possible. So it really is a stunning story. During this pandemic, the resolve and the engagement of Delta Dental and its foundation has been there, both in providing the dollars available for PPE and also helping move patients in overwhelmed ERs and hospitals and channeling those to the college so they can receive the care they need there. That brings us to the reason for today, which is to celebrate Delta Dental, also to celebrate the leadership of the college. Paul Mullasseril takes all credit for this, which I think is fair, and something I did as a dean. So I understand it. This has been a long time in the making. The ability to deliver to Northeast Oklahoma a comprehensive clinic, right? To have students complete their education and be educated in the Tulsa area, so hopefully they stay here. This would not have been possible. Today would not have been possible. Bringing all of this to Northeast Oklahoma would not have been possible without Delta Dental once again stepping up. We are creating something here that is special, and what we're announcing today, and what will be unveiled here, is another $2 million gift from Delta Dental of Oklahoma and its foundation to make this a reality, not just for our students, but for the entire region of Northeast Oklahoma. And the Board of Regents have already given the designation and appreciation for that gift so that the clinic will be named the OU College of Dentistry, Delta Dental of Oklahoma Comprehensive Care Clinic. That's fantastic. We're going to hear more about that. This is an exciting moment, and behind every exciting moment, there are the individuals that make these things happen. And I've only recently gotten to know John Gladden, who is the president and CEO of Delta Dental. But I've listened to the stories from all of my friends and my family about John and the creation of the foundation of Delta Dental of Oklahoma and the work that it has done and the work that it will do in the future is the product of someone who is an extraordinary leader that thinks not just about their organization, but about the impact it has on those around us. And we think about what the entire purpose of OU is under our strategic plan, that we change lives. All of that is personified in this individual. So we're honored to have you here, John. So please come up here. Thank you for all that you're doing. We're grateful.
Thank you, President Harroz, Dr. Sluss, Dr. Mullasseril, and Rieger, distinguished guests. So at Delta Dental of Oklahoma, we focus on one thing, and that's helping people get dental care. Only that one thing. And we achieve that goal through two methods. First, dental benefit plans. More than 1 million Oklahomans are covered by Delta Dental. People with dental benefit plans are 10 times more likely to receive preventive care and more than twice as likely to receive restorative care. The second way is we take the proceeds from that enterprise and we invest them to help Oklahomans without dental benefit plans receive necessary dental treatment and in support of dental education across Oklahoma. Oral wellness for all Oklahomans is our mission. Now for us, that means providing support for every single free and low-cost clinic in the state and supporting annual clinics like the Oklahoma Mission of Mercy or the RAM organization, along with other critical safety net programs like D.D.S and Eastern Oklahoma Donated Dental Services, Women in Recovery, and our Navigator program it directs people in need to the right resources for treatment that are often difficult for them to find. It also means sending Captain Supertooth and Mouth Science kits to every elementary school throughout the state to foster good oral hygiene practices in our state's youth. A vital partner in our mission for oral wellness for all Oklahomans is the University of Oklahoma's College of Dentistry. Our two organizations have been partnering for the past 2 decades on a multitude of projects impacting Oklahoma's oral wellness. Our two organizations, as I just told the dean, we go together like peas and carrots. We are in perfect alignment in 3 very particular areas. First, Oklahoma needs dental professionals, dentist, hygienist, and specialist. And all 3 are trained at the OU College of Dentistry in numbers that help refill the ranks of retiring dentists. And as someone who has audited many classes at the College of Dentistry personally, I can say with confidence that training is top notch. Seriously, one of the best in the nation. Number two, the OU College of Dentistry Student Clinic provides professional and affordable dental care for many, many Oklahomans that are in need. Low-cost, affordable dental care is just as important as free care, maybe even more so in many cases. The faculty and the staff work hard to fill this need with professionalism and attention to patient needs. And then the third, of course, is volunteerism. The OU College of Dentistry faculty, staff, and students provide essential volunteerism in many of our state's benevolent dental care programs. We can always count on the OU College of Dentistry faculty and students to be the first to volunteer and stay until the job is done. Without their volunteer spirit and the actions, the needs of many, many Oklahomans would go unmet. So, goodness. Your head is supposed to swell when you do these, not shrink. So for these three reasons, and frankly, many more, we are all in when it comes to supporting this critical Oklahoma institution. No other single organization impacts dentistry in Oklahoma on so many levels. We feel blessed to have the opportunity to provide support to the OU College of Dentistry in multiple programs and support their efforts to lower the barriers for dental care for most Oklahomans. So on the behalf of our entire organization, the Delta Dental of Oklahoma Board of Directors, our staff, participating dentist, and of course, everyone with the Delta Dental of Oklahoma ID card in their pocket, we thank you for the opportunity to play even this minor role in support of your mission to expand the OU College of Dentistry educational institution. So at this time, I'd like to invite Teresa Singleton, our director of the foundation, to join me in presenting the OU with the Delta Dental of Oklahoma's gift. And we look forward to seeing the difference this new clinic will make in the lives of Eastern Oklahomans for decades to come. Squeeze it in. Shall I go somewhere? Down there, maybe?
Let's do the check just one more down. There we go.
I'm the dean. I like that. See, that's problem solving right there.
All right, 3, 2, and 1. Couple more. 3, 2, and 1. Good to go.
Did you catch my smile?
Thank you, John. The funding from this gift has been instrumental in the development of this clinic. And as discussions of this new dentistry program began, I, like President Harroz, learned that 25% of the patients who receive care in the College of Dentistry clinic in Oklahoma City travel from the northeastern part of the state. That statistic alone shows that the need for affordable dental care in the Tulsa area is there and very needful of this investment on the part of Delta Dental. I'm thankful for the vision and leadership of the College of Dentistry Dean Paul Mullasseril, and he was instrumental in bringing the needed healthcare services to Tulsa. So Dean Mullasseril has joined us today. I'd like to invite him to the podium now.
Well, I have 7 pages, one less than you, President Harroz. So, and I have 5 minutes as well. So we'll see where this goes. You mentioned my name several times. President Harroz mentioned it, and President Sluss mentioned it as well. But Dr. Comia, if you're watching, this is your vision, and it's happening at the College of Dentistry. So I want to, right at the top, just acknowledge his contributions and give him a hand of applause. It is the dream of every dean to have a private organization whose vision is congruent with the vision of the organization. And that's what we have enjoyed for the past 2 decades, is that your mission and our mission mesh well together, as you mentioned, like carrots and peas. Although I don't like either, so. I would like to thank the leadership of John Gladden and the support of Teresa Singleton for this effort. The OU College of Dentistry is this state's only D.D.S. surgery program. As President Harroz referenced, more than 73% of the state's practicing dentists are our graduates. The College of Dentistry was founded on the principle of providing high-quality dental care at an affordable rate to the citizens of Oklahoma. And 50 years later, that is the reason we are here. That is the heart of what we do. And that's the reason we're expanding to Tulsa. However, there's still a lot of work to be done. Currently, Oklahomans rank 49th in the nation for access to oral health care per capita. And it has been reported that just 58% of Oklahomans receive regular oral health care. For oral health care to be effective, it needs to be both accessible and affordable. In many ways, those statistics were a part of the rationale behind this expansion project. As the state's only clinical program, we have an obligation to provide this care and lead the way in making sure that oral health care is accessible and affordable. The Delta Dental of Oklahoma Comprehensive Care Clinic will be located on the 3rd floor of the Schusterman Clinic. Construction is currently underway, and we anticipate that the construction will be completed and we will be ready to begin treating patients beginning of June of 2022. Thanks to the generous gift from Delta Dental of Oklahoma and its foundation, this state-of-the-art clinic will provide patients of all ages with access to comprehensive oral health care, services ranging from routine dental cleanings and fillings to advanced procedures including crown and bridge and implants, using the most state-of-the-art technology there is. We have several students here who will be a part of the inaugural class on the Tulsa campus. And at this time, I'd like you all to stand up and be acknowledged. As a clinical education program, these students will be providing hands-on patient care under the supervision of licensed dental faculty. These students and the ones that follow will have completed their first and second years at the College of Dentistry in Oklahoma City. They will then move to Tulsa to complete their 3rd and 4th year of dental school here at the Tulsa campus. I want to stress to you the importance and the role that the dental school plays in the state of Oklahoma. Not only do we treat patients, not only do we educate the students, but when these students graduate, they provide care for thousands and thousands of patients. So the impact that we have just at the school expands exponentially when they graduate. Another thing that we like to instill in our students is the sense of community service. And that's the reason why, along with other organizations, we make sure they understand the importance of Kids Day that Dr. Haney used to supervise and currently takes part in it as well. Veterans Day, OK Mom. All of these events are free dental care for patients of different categories. And so I want you students to understand that when you graduate from the dental school, besides giving money to the school, you need to provide care to those people who would not otherwise receive the care. So we do what we can at the dental school. You need to do your part to make sure that these patients get treated appropriately. We are very excited not only to expand our pre-doctoral program to the OU-Tulsa campus, but also to bring comprehensive dental services to the OU Health Schusterman Center. Another dream for us as dental educators and as dentists is to work closely with our other specialties, with the medical specialties. While we strive to achieve that at the Health Sciences Center and do that to a certain degree, having everything in this one building is going to be key in providing that interactive care between dentists and other professions. Okay. Another dream of dentists is to, again, practice with the other medical specialties. Your smile conveys more than your mood. Oral health is an integral part of systemic health. And that is conveyed to our students on a regular basis, and that'll be in action here in the OU campus. So we look forward to working with our new colleagues on the OU-Tulsa campus. Before I introduce Dr. Wood, I would like to take this opportunity to publicly recognize and thank several individuals who have played a big role in making this dream a reality. And as I mentioned earlier at the outset, although I was mentioned several times, this happened many years ago, and Dean Comia, if you're listening, this is your vision. So hats off to you. I'd like to thank Dr. Comia, the former dean of the college and the current executive director of the American Dental Association, who saw a need and put his action into plan. It was his vision, persistence, and will not take no for an answer attitude that has brought us here today. President Harroz, the OU Board of Regents, along with the Oklahoma State Regents for Higher Education, for your wholehearted support and leadership. Thank you for that. Provost Sanders, Interim Provost Raskob, Jill Raines, Valerie Williams, and the entire HSE leadership team, thank you for all your support and guidance and for helping us meet the growing need for accessible and affordable dental care in the state of Oklahoma. Interim President Sluss, former President John Schuman, and the entire OU-Tulsa community who have embraced the College of Dentistry and already proven to be excellent partners. So thank you for that. I would be remiss if I did not extend a special thank you to all the dedicated deans, faculty, and staff of the OU College of Dentistry, and would you rise? Thank you. And some of them are back there behind the scenes, but working hard as well. In addition to their other day-to-day duties, all the while navigating through this thing called COVID, they worked hard to make this happen. The last 2 years have not been easy, and I want you to know that I sincerely appreciate your efforts. Lastly, the reason we are gathered here, how are we doing on time? President Harroz, am I okay? Okay. Okay. The reason we are gathered here is this clinic would not be possible without the generous support from Delta Dental Oklahoma and Delta Dental of Oklahoma Foundation. The College of Dentistry is very proud to have had this long-standing relationship with Delta Dental, and I hope it continues in the future. For more than 2 decades, Delta Dental of Oklahoma and the foundation have generously supported the college through various programs, events, and initiatives. We are especially proud to partner with them on this new venture. In the book called Go Giver, the authors describe the 5 laws for stratospheric success of any organization. And I won't go through the entire book, I promise. I'll just mention 2 which are applicable to Delta Dental. It's called the law of value. Your true worth is determined by how much more you give in value than you take in payment. And the law of influence, which states your influence is determined by how abundantly you place other people's interest first. And that is exactly what Delta Dental and Delta Dental Foundation of Oklahoma does, and I thank you for that, John and Teresa. And now I'd like to introduce Dr. Wood. And at the inception of this project, one of the things, if you know Dean Cormier, he's 100 miles every day, all the time. So we needed to find somebody close to that, if not exactly to that level, in some respects. And we found the right person, and that's him right there, Dr. Wood. Thank you very much for agreeing to do this, and I feel pretty confident that under your leadership here in Tulsa, that this is going to be a success. And if you make it a tremendous success, Delta Dental and myself will ask you to have other clinics around the state. Okay? He has been a faculty member. He'll be directing our clinical operation here in Tulsa. He's a native of Tulsa and a 1981 graduate of the OU College of Dentistry. Upon graduation, he established a private practice in Tulsa, which he still owns and operates to this day. In addition, he has been a faculty member at the college since 2006. How does that happen? How does he manage that? I have no idea. Currently serves as a group practice director in the Division of Comprehensive Care. He has served as the chair of the first Oklahoma Mission of Mercy, a free dental clinic offering treatment to patients that are uninsured, underinsured, and would normally not have access to care. So he, along with Delta Dental, who are partners right from the beginning, have made this happen, and this is our 10th year. We didn't do it last year because of COVID. Hopefully we'll do it again next year in Shawnee, Oklahoma. So this is a good partnership between the dental school again, Delta Dental, the Oklahoma Dental Association. Please stand, Oklahoma Dental Association, the leadership of Oklahoma Dental Association. And the reason I mention that is because this is a great, great partnership between the school, the private sector, and the organized dentistry. And that's what's made our school a success in the state of Oklahoma. Coming back to Dr. Wood, I'm sorry, I digress. Additionally, he's the past president of the Oklahoma Dental Association and the Tulsa County Dental Society. His numerous honors and awards include the Pierre Fauchard Academy's Distinguished Dentist Citation, the Oklahoma Dental Association President's Leadership Award, and the Thomas Jefferson Citizenship Award. He currently serves America's Dentist Care Foundation as the president of its board of directors. Please join me in welcoming Dr. Rieger Wood.
Thank you, boss. Wow. I am so excited to be here today. This event is finally coming. As I announced to the students the other day, this is kind of like a pregnancy. You know, you find out when you're pregnant, and then you see the ultrasound, you see it growing. Well, we're kind of at the ultrasound stage right now across the street. But we know that come May, we're going to have the delivery. And it would not all be possible without John Gladden's help, and I'm so grateful. And the vision of Dr. Cormier, my friend, former boss. Raymond, we miss you and wish you were here today. Dr. Mullasseril, thank you very much for introducing me. As you said, I've been on faculty for over 15 years, and I've been selected to head this up. And it's a great honor, and one that I'm very, there's two sides of it. You know, you're excited, you're worried, you're anticipating what's going to happen, but it's kind of like that first Mission of Mercy. It happened, and this is like the first Mission of Mercy on steroids. Not only is this an historic event for the College of Dentistry, but it's notable for the city of Tulsa because we need this so much. Many of you know Tulsa is a very special place with me. It's my home. We have a lot of wonderful attractions in Tulsa. It's a metropolitan setting. And as a native Tulsan, I'm both excited and proud to bring this high quality of care that we offer in Oklahoma City to Tulsa. and to the northeastern part of Oklahoma. OU holds a very special place in my heart. Excuse me. My wife and I met at OU. We met the first year of our schooling. She's a hygienist. She's chair of the Department of Hygiene at the school. And her son graduated from OU as well in the dental school. So it's a very, very special meaning to us. As Dean Mullasseril referenced, Oklahoma ranks 49th in the country. And that's a big job for us as dentists because we have to turn that around. And we need to improve the care of oral health in Oklahomans, one step at a time. You can't do it all at once. But this is the nice, great big step we're going to take. Currently, there are 50 dentists for every 100,000 people in the state of Oklahoma. The national average is 60.5. We're behind. We need to improve that, get more dentists in our state. They've got to be well trained. They've got to have compassion. They've got to be complete persons. And that's what we need as educators to instill in our students. Also, 24% of our state's population is 15 minutes away from a dentist. So there's people that drive a long ways for dental care, especially as you get out and you leave the metropolitan areas. We really need more dentists to take care of those folks. At the OU College of Dentistry, our mission is to improve the health of Oklahomans, as we've hammered home, driven that message home today. And we strive to be the source of dental care throughout the state. We want people to look to OU College of Dentistry as the source of dental education and taking care of folks. Over the last 5 years, we have treated over 285,000 people in Oklahoma City. That's an incredible number of patient encounters. And we are going to continue to forge those relationships with the community and expand access to care into Tulsa. You know, we can help those senior citizens that are on fixed incomes. What a great place to come to our clinic and have quality care. And those folks tend to develop the most incredible relationships with their students. And that's a teaching moment in itself for those students to be able to talk to those older folks, maybe not all older, but some of them are, and they can learn a lot from those people, a lot of life lessons. And the expansion of the College of Dentistry program and this new Delta Dental Oklahoma Comprehensive Care Clinic, it's going to play a significant role in access to care. And while we do have some free low-cost clinics in Tulsa, there's not as many in Tulsa as there are in Oklahoma City. And in contrast, our college will provide comprehensive care. We'll have preventative care with cleanings, examinations, sealants, but we have a wide variety of restorative care, everything that you would get if you went to a private practice. Fillings, crowns, bridges, implants, root canals, dentures, partials. We truly are a comprehensive care clinic that's coming to this campus. I've had the pleasure of meeting with several physicians over here over the past 3 months, and I want to say how welcoming they've been and how excited they are to have dentistry coming to their campus. And vice versa, we're excited to be a part of that team because that collaboration potential is amazing. I've already had different specialties contact me about sending residents to our clinic to spend week-long rotations. That is magnificent because a lot of times physicians truly don't understand what goes on in dentistry. Yet dental students are trained more to be able to talk to a physician than the physician is to talk to a dentist. So this is a great opportunity for both of us to work in a collaborative, promoting professional relationship. Again, it's an honor for me to lead this dentistry's clinical education program and oversee the clinic operations. I want to thank everyone at the Tulsa campus for being so warm and welcoming. And I want to thank Delta Dental, who is truly a giant in our profession. Their contributions to the dental community is absolutely amazing. I never miss an opportunity to thank them for the first Mission of Mercy back in 2010. And John, I want to thank you for that, because that event really emulates what dentistry is about. It brings dental students, dental hygiene students, dentists, faculty, and lay people from the community all together to see what's the best dentistry has to offer. Thank you, John Gladden. Thank you, Delta Dental of Oklahoma. Thank you, Delta Dental Charitable Foundation. Thank you, Teresa Singleton, for improving the educational opportunities for our students, for promoting access to affordable care to all Oklahomans. We are most grateful for your charitable generosity. Thank you so much. God bless you.
Thank you, Dean Mullasseril and Dr. Wood. I look forward to working with both of you to bring this important healthcare service to our community. The work performed by you and your students every day in the clinic will bring needed services to our community. This is an exciting announcement for OU-Tulsa, the College of Dentistry, and all of northeastern Oklahoma. The Schusterman Center Clinic is uniquely suited to house this student dental clinic, given our long history of community engagement and providing health care and now dental care to Tulsans and patients from the surrounding areas. I also want to thank Delta Dental of Oklahoma and the Delta Dental of Oklahoma Foundation for their support of our program with this gift. This gift will make northeastern Oklahoma an even better place to learn, live, and work. Thank you all for being here today to celebrate this exciting announcement with us. At this time, I'd like to invite the representatives from Delta Dental of Oklahoma and the Delta Dental of Oklahoma Foundation to the podium for a presentation of a framed rendering of the clinic.
All right, this time I'm gonna have everyone stand right here in front of the podium with me right here.
Beautiful. So we have an OU College of Dentistry meeting room at Delta Dental headquarters, and this is gonna look great in there.
All right, let's get everybody in there for me, please. Let's move a little bit to the right, a little bit.
Over
To
here?
the left.
Yeah.
Okay. There we go. Just a little bit more. A little bit more, a little bit more. Jim, you share the holding that with us for me, please. Scoot it toward the center of you guys.
The other center. Oh, okay, that way. All right.
There you go. And let's scoot everybody just one little foot that way.
1 foot.
There we go. Now you guys scoot up a little bit for me.
I know.
There we are.
This is
It's
serious.
like your wife's situation.
All right. 3, 2, and 1. Come more. 3, 2. And we are good.
Thank you. We're adjourned.